Your shoulder hurts and you're not sure if what you're doing in the gym is making it better or worse, and you're tired of babying it. You want to get back to exercise. I'm Dr. Pastuch, owner and founder of Active Life. And for the last 20 years, I've been a chiropractor and a personal trainer helping people get out of pain without going to another doctor's office or giving up their active life. The concepts I'm going to teach you in this video have been tested and proven in real life with real people throughout my career. In this video, I'm going to teach you what Active Life's definition of pain is and how you can use that to determine if what you're doing is actually making you better, worse, or nothing at all. If you told me that your shoulder hurts when you do an exercise,
shoulder do hurt.
You'd say, I get pain when I do this. And then I would say to you, what do you mean by pain?
What do you mean? What do you mean?
You might shoot me a blank stare and say, oh, I don't understand what's confusing about that. But this is really important because if I asked 100 people what pain is, I'd probably get 100 different answers and none of them would be this one, which is how pain is defined. To make it even simpler for you, the way that we define pain at Active Life is you felt something and you didn't like it. That's it. You felt something and you didn't like it. It doesn't mean it caused a problem. It doesn't mean you need to change anything. It just means you felt something and you didn't like it. It's a negative emotion tied to a stimulus. Now that we got that simple definition out of the way and you have it in your head, pain is just something that you felt and didn't like. Let's stop being so emotional about it and create some logic so that you can have the clarity that you need. Because of course the biggest fear that you have is, well, what if I make this worse? What if the pain gets worse? What if I re-injure? I don't want to get surgery. I don't want to need to get shots. I don't want to be on medication for the rest of my life. And I don't want to have to stop doing this stuff. I'm going to give you the clarity that you need so that you can make smart decisions on science and logic instead of making decisions based on potential fear around what you felt when what you felt is poorly defined. I'm going to give you 4 really simple rules to follow. Now you might be thinking to yourself, I don't want rules. I'm here for freedom, bro.
America!
I'm in on it. I'm in on the freedom thing. Rules give you freedom. We know what we can do, we know what we can't do, and that gives us the ability to do everything that we want within the rules, because the reality is that without these rules, you will get hurt. You will find yourself unable to do all of them, not as a result of me telling you, tisk, tisk, you can't do it, but because your body is physically going to be incapable of doing it. You don't want that.
I broke my back.
These rules are simple, and you're the one who's in charge of how they actually work. Rule number 1 is going to require you to build in your own mind a scale of 1 to 10 for how much you're in pain. 1 is actually pretty pleasurable. You don't mind it. It's like waking up in a soft bed in the morning, comfortable, ready to stretch and take on your whole day. That's a 1. A 10 is I'm calling 911 and we're getting an ambulance and I'm going to ride in it with you because you are going to the hospital. That's 10 out of 10 pain. None of that feels like pregnancy or a kidney stone. If you haven't passed a kidney stone or pushed a kid out of your vagina, you don't know what that means. If you're feeling your pain 5 out of 10 or more, and you're in charge. Is it a 5, 4, 3, 2, 1, a 9? You're in charge. If you're feeling it less than 5 out of 10, we're okay. We don't need to stop doing what we're doing. That might be what we call at Active Life irritation. And irritation drives adaptation. Think about this in your life. Is there anything you've ever done that you're proud of that didn't require some difficulty or pain along the way? No. If it didn't, you wouldn't be proud of it because it would have been too easy. This is the same. You're going to experience some discomfort on the way to being comfortable. So less than a 5 out of 10 is acceptable. Remember, really important, I probably should have said this at the beginning, this is not medical advice. I'm not telling you what to do. This is not prescriptive. I don't know your situation. I can't tell you exactly how to resolve it. Okay? These are general guidelines, and they seem to work most of the time for most of the people. That's rule number 1. If it hurts 5 out of 10 or more, stop. Stop. Lighten the load, change the range of motion, do a different exercise, whatever you need to do to reduce that discomfort. Rule number 2, when you start doing something, as long as it's hurting less than a 5 out of 10, and it gets better, or it stays the same from rep to rep, we're good. If it gets worse from rep to rep, we're not good. We don't need to take something that was a 2 and do all the reps until we're like, I got until a 5, bro. No, you don't. It's getting worse. We don't need to see how much you can make it hurt. Things can go from a 2 to a 10 really quick if they're getting worse from rep to rep. So be cognizant. Is it getting better as you do it? Is it staying the same? Or is it getting worse? If it's getting better as you do it, you probably don't need rest. That's a decent indication that blood flow is improving the quality of the tissue and reducing the likelihood of injury. That's why your body is giving you more range of motion and more freedom to do it without discomfort. If it's feeling the same, you might be having absolutely no influence on the structure that's causing you discomfort at all. That's a good sign. You're unlikely to do damage if something isn't having influence at all. If it's getting worse, we want to pull back. There's no reason to test it. If it's feeling worse, stop. Lighten the load, change the exercise, change the range of motion, whatever you need to do there. Rule number 3, as soon as you stop, so does the pain. Think about it this way. You didn't have shoulder pain before you started pressing or pulling or whatever have you. But as soon as you started, you felt it. It was a 3 out of 10. And as you went, it stayed the same or it got a little bit better. And as soon as you stop, you put the weight down, pain is gone. That's a good sign that you didn't do any damage. Think about it. If you did damage to a structure, that damage would be there while you were doing the exercise and after you stopped. And it would still hurt after you stopped.
Not here or here so much, but right here.
So if you don't feel discomfort once you stop, the pain is gone. That's a really good indicator that you didn't do any damage during that exercise. This should already feel really freeing. See how these rules create freedom? Rules equal freedom. Discipline equals freedom. That one's not mine, but the rules equal freedom. We can take that, right? Yeah, we can take that. It's mine, baby. Rule number 4, 24 to 48 hour rule. If 24 to 48 hours after you're done doing the exercise that caused you pain, you don't feel any pain, we're in the clear, baby. We're winning. This is winning season.
Wow, winning.
What we're looking for here is, did you cause damage while you did the exercise that maybe you didn't feel in the moment, but that 24 to 48 hours later reared its head? Kind of like DOMS, but really specifically in a spot where you felt it while you were doing the training. So it's important to be able to differentiate what DOMS, delayed onset muscle soreness, the soreness we feel from exercise, and the pain that we're concerned about are. DOMS are going to be in a whole area. It's going to feel like soreness throughout a muscle. If you stretch it a little bit, you're going to feel it's going to feel like you're stretching even more than you usually would. The pain we're concerned about is more like, I can take my finger and point right there or right there. It doesn't matter where, all the places. It doesn't matter. As long as you can take a finger and put it on that spot, that's problematic. It's also, I feel it here and then it radiates out to all of here. That's problematic. Or when I stretch it, it feels like this one little spot right here is going to tear in half. That's problematic too. So what we're looking for is 24 to 48 hours after we did the thing, we don't feel the same pain that we felt while we were doing the thing, or more than we felt while we were doing the thing, or even different than we felt while we're doing the thing. DOMS, good. These specific pains, bad. It's an indicator that what you did might have been too much, and that's okay. We're just going to do less or something totally different next time. Let's wrap this up. Is your shoulder actually hurt? Are you making it better, or are you making it worse, or are you doing nothing at all? Rule number 1, on a scale of 1 to 10, is it less than a 5? Rule number 2, as you do it, does it get better from rep to rep, worse, or stay the same? Rule number 3, when you stop doing whatever you're doing, does the discomfort, the pain you were feeling, go away or not? Rule number 4, 24 to 48 hours later, can you point to the spot? Are you feeling like you're still in the set, or is it just DOMS or nothing at all? As long as you have the right answers to all 4 of those questions, you're in the clear, probably. Disclaimer, not medical, yeah, yada, yada, yada. I'm Dr. Sean Pastuch. Remember, like and subscribe if you're enjoying this content. Send it to your friends, and pain is a choice. Let's make it good.